Dr. Sourabh Kulkarni. I'm an orthopedic consultant and robotic joint replacement surgeon practicing in Navi Mumbai. This gentleman was an 86-year-old man. He had severe pain in his knee joints when he presented to me. When I examined him thoroughly, both the knee joints were bent inside almost 20 to 25 degrees. He even could not make those legs straight and really was having significant difficulty in walking. Around 30 years back, this patient had an accident where he had his tibia, that is the leg bone, which was fractured. And at that point, it was not properly treated. So this went into a malunion. Malunion is an abnormally united fracture, which led this leg even more bowed inside and which was putting a very bad load on his knee joints. Ultimately, he landed up into severe deformity of knee joint, and this gentleman was having a really bad knee pain. His life was difficult. Day-to-day life also was very difficult. The challenges in his case to me was his 86-year-old man. This 86-year-old man cannot survive a very prolonged surgery and also is not a very fit patient for doing these surgeries at an interval of 5 days or interval of 1 month. So I decided to do a bilateral knee replacement at a single setting, and I think the robotic was the best choice for him. Another challenge in his case was malunited tibia. So the planning of implant, whether this person can suffice a normal knee replacement or an advanced implants are required for his surgery, that usually is decided by a CT scan. So we did a CT scan for this patient. The CT scan showed us the defect on both the sides, and we could plan the implant very properly in his case. Even because of his bad knees, we had to put another rod into his knee joint or in his leg bone, which also we could plan on CT scan very nicely. And these all precautions, these all advances that we used for him, they came to really great help, and we had a successful knee replacement for him. So this decision of us doing a robotic knee replacement in this gentleman was a great decision according to me, because his surgery was one of the most successful surgeries that even a robotic or a joint replacement world has seen. 86-year-old gentleman could start walking in 8 hours time. The same day in the evening, he could stand on his legs. In 24 hours, he started walking with a walker without support of anybody. He could have a toilet training. In 2 days' time, he could go to the toilet and come back. To our surprise, he could bend his full knees to a full range of motion in 2 days' time. And also on a third day, he climbed stairs up and down. Fourth day, he was discharged. When he came for suture removal, at that point of time, he was walking without any support, and in a month's time, he could sit cross-legged also. The biggest gift that a patient can give to a doctor is a smile on his face, and this gentleman was having the smile all over his face when he presented to me on maybe 6 weeks post surgery, and now he is living a very soothing and painless life in his hometown.